let's just look at this image. This is one of the very common questions which you are going to get. You will get, in the case of hemorrhages, you will get CT images. Okay, how to differentiate between MRI and CT images? Have a look at this. Have a look at this. Okay, look at the density. So in a CT, the bone will look very hyperdense. Okay. In our later on classes, I will tell you how to actually differentiate between a CT and MRI. But just for sake of this, just look at the bone. Okay. Now let's start. What you are going to get in your exam? You are going to get this. Within history, like a young boy met an accident, with a road traffic accident and unconscious, lucid interval, these kind of terms will be used. And this is you are going to get as an axial CT image of brain. Now, what we are able to see? Have a look. We are able to see a lentiform shape. This lentiform shape, hyperdensity. Okay, in the right side. Now, what is this? This is, first of all, the most important thing is that shape, biconvex. Biconvex shape with mass effect as it's leading to midline shift. Okay, the midline is shifted toward it, so it's an extra axial collection which is shifting whole of the brain towards the opposite side. Okay, it's hyperdense. In CT, we use the word hyperdense. For white, we are using hyperdense. For black part, we use the word hypodense. So don't get confused with it. Okay, the first part is it's biconvex in shape. Okay, now let's give you an idea. This is brain. This is vault. Okay, this part is vault. So there are three membranes in between. Dura mater, the most outer one, the arachnoid, and the last one is the parameter, which is adhere to the brain sulci and gyri. It's adhere to that. Dura mater is adhere to the bone. Okay, the skull vault, it's adhere to it. What happened? As per the name, extradural hemorrhage. What it's tell? Extra to what? To dura. Yani, it is outside the dura mater, between the vault and the dura mater. So a collection is between the dura mater and the bone vault. Okay, so this is extradural. Now, the frequently first question will be your diagnosis. What is the diagnosis? Second question will be, what is the culprit or the artery or vein involved in it? So the most common is middle meningeal artery. So first question will be diagnosis and second question will be the middle meningeal artery is the most common artery that is involved in it. Okay. Third question is swirl sign. The HU value of clotted blood and fresh blood is different. Fresh blood is of low HU value, whereas the clotted blood is high HU value, high Hounsfield units. These are called Hounsfield units. So, as the fresh blood is, what happens in an acute case or an hyperacute case, when fresh blood is oozing, so it can appear hypodense. Okay, it can appear hypodense, which give an hyperdense. The whole bleeding part is looking hyperdense. What we are looking out here is hyperdense. But if you are able to see few hypodensities within, that is called swirl sign, which is due to active bleeding within it. Okay, let's move to the second type. Now, we have completed the extradural hemorrhage. Now let's come to the second type. Have a look to the image. This is what you are going to get in your examinations. They are going to give you this, and generally history kind of provided ki no history of trauma associated or something like that. Just have a look. Okay, what you are able to see is that a concave, we have already talked about this. First we have to look for the shape. In the extradural, we are able to look at a lentiform shape or biconvex. What we are having here is convex. concavo, convex. Okay, just have a look. This whole part. Okay, it is hyperdense and it's concavo convex in shape. The first question is the shape, which will help you for the diagnosis. Second question, the culprit, the artery or vein, whichever is involved. So it is due to tearing of bridging cortical veins. As we have discussed, that beyond this cranial vault, there is a layer called dura mater, which is closely adhered to the skull wall. Now, next part is arachnoid matter, where I'm going to mark it with the green. This is arachnoid layer. Okay, as the name suggests, subdural. Okay, as the name suggests, subdural. Here the collection is between dura and arachnoid. Okay, this is the part where collection of blood is there. Okay, now one more important thing is there, which can be asked in exam in form of some statement or like that, ki how you are going to differentiate EDH and extradural and the subdural. So as per the name suggests, first we have talked that extradural will be of lentiform shape, biconvex. The next one, SDH, subdural, will be concavo convex. Now one more thing is there, which will help us to differentiate between them, that extradural hemorrhage is limited by sutures, but here subdural is not limited by sutures. One more important point is that subdural is not limited by the sutures, but it is limited by dural reflections. Okay, what are dural reflections? Such as falx cerebri, tentorium, or falx cerebelli. Okay, so these are the point that ETH is limited by the suture and the subdural is not limited by the sutures, but it's limited by the dural reflections. Okay, so these are the important points regarding the extradural. We have covered the subdural. Then the next is subarachnoid. Just look at this image and try to make a diagnosis. Okay, so this is subarachnoid hemorrhage. So the first type of question will be the diagnosis. Okay, the first will be the diagnosis. It is a subarachnoid hemorrhage. So as the name suggests, it's beneath the arachnoid layer. So what is subarachnoid space? Beneath the subarachnoid layer, there is a subarachnoid space, which contains CSF. So there are subarachnoid cisterns in which blood is going to get accumulated. What we are looking out here, these are the cisterns. Okay, have a look. These are the cisterns. Few example of subarachnoid cistern could be asked. Sylvian cistern. Okay. Sorry for this mistake. Cisterns. Okay. Sylvia cistern, suprasellar cistern, quadrigeminal cistern, and prepontine cistern. What is the common cause of subarachnoid hemorrhage? aneurysmal rupture. Okay, this is an important question. Aneurysmal rupture is important part out here. Okay, subarachnoid cistern, and the most important part is diagnosis. Okay, so three type of questions can be asked through this part: aneurysmal rupture, the diagnosis, and the subarachnoid cisterns. They could ask about that. Okay, let's move to the next part. Have a look to this image. What you have till now: extradural, subdural, subarachnoid. We are talking about the blood component within the layers, outside dura mater, below, या फिर medial to dura mater, or subarachnoid. We are talking about that. Now we are talking about intracerebral hemorrhages. Okay, have a look. We are looking at a hyperdensity in the region of left basal ganglia, likely putamen. So this is intracerebral hemorrhage. So this would be the first type of question. What is the diagnosis? Second could be cause. What could be the cause? Hypertension. Hypertension is the most common, one of the most common causes. Now the main important question is, what is the most common site of hypertensive bleeding? So the most common type is, the most common site is basal ganglia. Basal ganglia. Within basal ganglia, putamen is the most common. And the second most common site is thalamus. Okay, so these are two type of questions which could be asked. Now, what could be the other causes of intracerebral hemorrhage? So, intracerebral hemorrhage could be of two types. It could be primary, it could be secondary. What is primary? Here, no underlying lesion is there. Okay, no underlying lesion. So now, what could be within it? First is hypertensive hemorrhage. Okay, and second could be lobar hemorrhage secondary to cerebral amyloid angiopathy. Okay, you should know about it if in case it's asked. I have told you the important and most frequently asked questions. These are that you should know about it in case it get asked, so you should be able to answer this part. Okay, what is secondary intracerebral hemorrhage? It is some other lesion had complicated by, or is complicated by, some other lesion is complicated by hemorrhage. Okay, let's see few examples. Vascular malformation. It's complicated, can be get complicated by hemorrhage. Okay, vascular malformation. Next will be any tumor, and other one will be cerebral venous thrombosis. Okay, so what we have covered yet? Have a look again. So first important part is, we will look to the image, whatever is provided. We will see if it's an MRI or a CT. If these kind of images are provided, I have already told you, look for the bone. If it's very hyper, so most likely it's a CT image. Okay, then look for the shape of the hemorrhage. So first was the extradural. Okay, it was biconvex in shape. Okay, and the important question was middle meningeal artery was the culprit out here. Now we have already discussed about the swirl sign. Okay, then next one was the subdural. Okay, concave convex was the shape, and it was due to tearing of bridging cortical veins. Then the third one is subarachnoid hemorrhage. Common causes aneurysmal rupture. And cisterns get filled with the blood. We have named various cisterns like Sylvian, suprasellar, quadrigeminal, and prepontine. And the next one was intracerebral hemorrhage. Okay, so most common cause is hypertension. And what's the most common site of hypertension bleed is basal ganglia. And within basal ganglia, putamen is the most common site. Beyond that, second most common site, sometime it had been asked. So thalamus is the next most common site. Then intracerebral hemorrhage, we have talked about it, that it could be a primary, it could be a secondary. In primary, no underlying lesion will be there. Hypertensive is the most common among them. And second could be the central amyloid angiopathy, which is leading to a lobar hemorrhage. Now, the secondary type are there in which some other lesion get complicated with the hemorrhages, in which we have talked about vascular malformations, formation, any tumor or cerebral venous thrombosis. Okay.